TNT Open Mind Insights brings you powerful, authentic conversations, illuminating the path to better mental health care for all.
Leandra, thanks for taking time to
Yeah,
meet with me today. I really
thanks for
appreciate it.
having me.
Yeah, and I know you do so much in the world of behavioral health, but I was wondering if you could tell me a little bit about what you do, um, and why you do it.
Wow, that's how long do we have?
Yeah, so we have forever. Let's hear it all. So, no, but yeah, what just like an idea, because I know you are a mover and a shaker, particularly in California. But you know what they say, what happens in California happens in other states. So really, I see that your work as being replicable and transformative in other states indirectly. But what do you do?
So I'm a psychologist by training. I always tell people that I'm a clinician at heart. That's
Yeah,
where my training started. That's where my ideas around helping people, disenfranchised populations started.
yeah,
And I never imagined that it would transform into this policy journey.
yeah.
And so I am the CEO of the California Behavioral Health Association. And I also run an association where I'm the executive director. It's the California Access Coalition. Um, my journey to that has been long and
Yeah.
storied and really wonderful. I feel
Mhm.
so privileged being a former provider, having the opportunity to lift up the voices of folks that I used to work with.
Yeah,
Feels so good to me and so
yeah.
valuable. So CBHA represents behavioral health providers across the state. We're the
Okay.
most diverse behavioral health association. We're diverse in terms of our staff, the CEOs and leaders of the organizations we represent, and the people that they serve. Our members are in every region of the state. They provide a myriad of services from housing and outpatient services, inpatient, mobile crisis. A third of the 98 call centers belong to our membership. 25% of our members are FQHCs, and half of the CCBHCs in the state belong to us. So it's a big, diverse group, which I love, and it's a big charge in terms of policy and advocating for these different agencies because we have such a breadth of members and expertise. So again, I feel super privileged because
Yeah.
I used to work at a CBO. I used to be in the trenches delivering, those services. So to be able to lift up their voices as they serve their clients is just really amazing.
So now you can help those who are on the front lines, or as you say, in the trenches, because it's not easy, by the
Not at
way.
all.
I don't,
Not
right?
at all.
You're a psychologist, I'm a psychiatrist.
Hmm.
We both know it's not easy doing this. It's hard work, but
Definitely.
I think it's important work.
Oh,
This is what I'm hearing from you, and
critical.
I agree.
Hmm.
Tell me a little bit more about what that means, representing or advocating for them. What's a day in and day out? Like, who do you talk to try and advocate for these folks
Who
who are in the
don't who
trenches?
don't I
Who
talk
don't
to,
you talk to?
right? So I
Exactly.
have a really great team at CBHA
Uh,
of advocates and people that really get it. Either they've had lived experience
uh,
or folks in their family or their community have, or they just have a passion for
mm,
behavioral health. So I don't do anything by myself. I have an amazing team.
okay.
But what we do is we provide services to the members that we
Uh,
represent.
yeah.
We have meetings, conferences, policy forums. We do a lot of education.
Mm,
We also do a ton of advocacy, and that's really what CBHA is known for historically.
mhm,
Our founder, Rusty Seelix, was really a giant in the field of mental health
mhm,
and was ahead of his time in so many different ways.
mhm.
He founded CBHA and really took it to the next level. So
Yeah.
I just feel, again, privileged to be able to fill those shoes and to take it to the next level in
Yeah.
2025.
I
Yeah.
didn't realize that he founded the association. I
Hmm.
know that he was key in developing the Mental Health Services Act,
Hmm.
which came out in 2004, I think, which is the sort of millionaire's tax, right? So
Yes.
everyone who makes over $1 million gives an extra 1% of that revenue towards behavioral health.
Hmm.
Um, but he is a giant, and you took over for him. It sounds like. Um, do you represent pretty much all types of providers, behavioral health providers in California?
Yeah, there's a great diversity, as I, mentioned earlier, from housing to outpatient to inpatient,
Yeah.
98 call centers, CCBHCs, FQHCs. And I love that. I love that our members serve everyone, the entire lifespan from, prenatal care all the way to end of life. We have
Yeah.
members that specialize in just providing services to older adults, right? So to have an association that is really a one-stop shop and
Hmm.
represents all of those voices and the
Yeah.
diversity of services feels really authentic.
Yeah.
And it's a heavy lift,
Yeah.
right? Because there's so much that we have to do. There are so many people that we are representing who are doing really God's work, I think, and the heart work, which helps tons of folks in disenfranchised communities and
Mhm.
otherwise across California really get the work done and get the services they need.
Yeah, and it's again, your focus is on those who are under-resourced, underserved areas to really kind of focus on those folks, which not a lot of people are doing. So it's needed. There's a lot of people probably who are going to listen to this who are maybe psychologists or
Mhm.
social workers, psychiatrists,
Yeah.
family medicine doctors,
Yes.
peer specialists,
Mhm.
coaches, etc.
All good people.
Yes. Here's my question to you. One, do you think it's important that they even think about advocacy? Is that important? And two, if they did get out there and advocate for their patients and their profession,
Mhm.
how do they do it?
It's incredibly important.
Okay.
Aside from leading the associations, I'm also very connected to, the guilds that I belong to that really represent the work that many of my members do and I used to do. So the Association of Black Psychologists, the American Psychological Association, on and on. They have played really critical roles and pivotal roles in my life as I have developed as a professional. And they continue to be our leaders as it relates to advocacy, as it relates to really defending the profession. And there's many guilds with many of the professions that you named that are doing that work and continue to. So
Hmm.
I think it's vitally important. I do think that practitioners, when we are training in our respective programs,
Yeah.
that we don't hear a lot about advocacy. It's one
No.
of my pet peeves. You get out of school and then you don't know how to really contribute to the profession. And you may want to,
Yeah.
but it may feel really daunting and far away. You can't just jaunt over to Capitol Hill,
Yeah.
right? And I think that these guild associations give a lot of practical ways that clinicians can get involved in I call it in their own backyards, right? How can you do
Mm.
advocacy in your own backyard? You may not be able to go to the state capitol,
Yeah.
as often as you'd like to because you're busy with your practice and serving communities, but you can get involved at the local level with your
Uh-huh.
board of supervisors. You can follow or even get involved in the licensing boards for your
Hmm.
professions. You can send in letters. I know some folks think that doesn't really matter, but it does.
Yeah.
All of these things. And you can join associations, you can join guilds, you can join associations like CBHA and others who are advocating for the laws that trickle down and impact the work that individual practitioners and community based organizations are doing. So I think we need more of that. And in fact, there are other professions that do a good job of infusing that into their curriculum. When their students, like for example, social workers,
Hmm.
they learn a lot about advocacy. They learn a lot about how to defend the profession. So when they graduate and they start serving the community, they're really clear on that mission.
Huh.
And I think we can do a better job overall. And we don't have to look far. We can look at the models that are out there and the professions that are doing it well and just really adopt those principles.
Don't recreate the wheel, right? And
Right. Who has time for that?
yeah, exactly. Join the association as a member. You guys have members for this
Well,
association.
many of the individual clinicians work for behavioral health
Okay.
organizations, and those organizations can join CBHA as an advocacy organization at the state level. I'm a member of the National Council for Mental Well-being and on their board of directors, and so they represent organizations like CBHA in every state.
Yeah.
And so there's opportunities for folks to join and to participate and
Yeah.
to advocate. You don't have to create it on your own. You don't have to
Hmm.
think it up. There's places where you can really plug into and get it done in an easy way.
So it's neat talking with you
Is it?
because let me tell you why.
Tell me.
Well, you're an awesome person to begin with, but you do some critical stuff with
Mm,
your team, and I
mhm,
know you always focus on the importance of your team
I do.
because without your team, it's not gonna happen.
Mhm,
But you lead this team to effect change. And what I've seen in the state of California, relative to other states, many other states, or most, if not all states, is that California has been uniquely innovative
mm,
and creative on how they are trying to develop a workforce
mhm,
and improve clinical care. I mean, the example is what was then Proposition 63
mhm,
back in 2004, the
mhm.
Millionaires Tax, or Mental Health Services Act, now the Behavioral Health Services Act.
Yes.
And so these are examples of stuff that's not happening anywhere else, right?
Mm,
That's that innovation that's put forward. Um, but here's a question I have for you. Are you ready?
I
This is the
think so.
question. Okay.
I don't know.
So the first the first question is, what's the most difficult part of your job? And second, what's the most rewarding piece of what you do on a daily basis? The most challenging or frustrating, and then the most exciting, fulfilling part.
Wow, that's a really big question. I
Yes.
think the most difficult part of my job is um, when we don't have control over some of the solutions that our members need, right?
Uh-huh.
So we are great at advocating. As you mentioned, Prop 63, that's part of, our founder and the work he did alongside Daryl
Yeah.
Steinberg. You know, that was amazing, and there were so many other things that Rusty, Daryl, other champions have really contributed to and
Yeah.
done. Um, and so I think the hardest part is really when we do all we can do and
Yeah.
still the change hasn't happened. At the same time, I know that this is a long game
Okay.
and that we have to keep lifting up the issues. And sometimes it's a matter of having it's got to be the right moment. It has
Hmm.
to be the right leadership there. It has to be folks with the right heart and understanding for behavioral health.
Yeah.
And so we've been really lucky, which is the second answer to your two-part question. We've been really lucky to have great leaders and advocates. Our governor shone a light on behavioral
Yeah.
health in a way that had never been done before by any other governor. This was a really high priority for
Hmm.
him. And so, though all of the advocates and consumers and folks in the state of California did not agree on every policy and how
Hmm.
it was negotiated and implemented,
Yeah.
the fact that we had that attention, the fact that we had that opportunity to weigh in, to really co create the vision is amazing and astounding. And as I mentioned, as I sit on national boards or have in the past,
Hmm.
I hear from other states what's happening there. And you're right, California
Yeah.
is innovative.
It is.
From Prop 63 to the CARE Act to so much more that is being
Yeah.
invested in our state. I'm really proud to do the advocacy here. I feel really lucky. For about 6 years, I worked in the state legislature, and it gave me a great opportunity to work very closely with policymakers and understand that process. I did that right before coming to CBHA. And so I know how hard it can be for advocates to get bills moving and policy changes happening. And the fact that our members and our association have been able to pull together and do that, it's
Yeah.
been amazing. And we
Yeah.
don't do it alone. We have other advocates, other organizations that work alongside us, other
Mhm.
partners that are allied in the same and with the same cause.
Yeah.
And that's how we get our work done. So that might be longer than
No, that's
you
perfect.
wanted, but
That's you're having your insight here is really it's really pretty cool, Leandra, because of your background. Again, going back to clinical, being a clinical psychologist to working in the Capitol for several years to what you're doing now,
yeah.
and so your vantage point is unique. Um, and we've done interesting things in California. There's been some really awesome gains. I think we deliver behavioral health care better than most other states
Mm.
because of this innovation and creativity, the investment in behavioral health. But what's the one thing that you're like, oh my gosh, we have to change this? This is just wrong. Is
Mm.
there something that is at the top of your list of things that we just got to change? Is there anything that
Well,
comes to mind?
the fragmented system of care that we have here.
Yeah.
We're a county-based system of care, and while our county partners try really hard, right, to work with our contracted providers and
Yeah.
others, we still are missing the mark, I believe. There's so much that can happen. There's so much efficiency that could happen that's low-hanging fruit,
Yeah.
yet we really get stuck there. And I think it really is because the system is fragmented. Our governor really worked hard to, through the most recent CalAIM 1115 waiver,
Hmm.
really recreate what behavioral health looked like in the state. And so we have a great foundation there,
Yeah.
but pulling it all together, funding it, getting all the different pieces to
Yeah.
agree continues to be a challenge. I'm not hopeless. I think we can get there,
Okay.
but that is something that really keeps me up at night and trying to figure out. I have members that are, serving in all of these different counties, and
Yeah.
there are some standard issues. Those are the low hanging fruit issues. And there are some issues where it's just so different by population, by service area, that we're still working towards figuring out answers. And it's really going to take the partnership with counties, with allied advocacy organization, with community-based organizations and others to really get this done. So we have to figure out a way to really work together
Yeah.
because, as you've mentioned, the opportunity is great here, and we
Yeah.
do have a lot of investment here. And we don't know what future leadership is going to look like, if there's going to be as much emphasis and focus on behavioral health. And so it's really critical that we figure out how to work together now so that we can serve the people who need it the most.
No, that makes sense. But anytime you have a lot of fragmentation
Mm.
organizationally, right, that results in poor use of money, poor
Yeah,
use of revenue,
definitely.
and it's pretty significant here. So increasing the revenue is not always going to be the answer if we're just fragmented
Right.
like we are when it
Yeah.
comes to behavioral health care. That's not necessarily true when we're talking about oncology care or rheumatology care or endocrinology
So
care.
true. Yes, it's so true. So I'm a recent breast cancer, survivor. And thinking about my own care
Yeah.
and comparing that to the care that our members provide our, lots of clients across the state,
Mm.
it's incredible the disparity there. I got my diagnosis. I was rushed right in. I was given options and told, what I can do, when I can do it. Just all types of things were available. There weren't stumbling blocks on payment. It was taken care of.
Wow.
It was something I dealt with later if I needed to, right?
Yeah.
And so going through that process, a professional advocate, going through that process, I was still just struck by the changes and the differences in the system. Now, I'm not saying that the physical healthcare system was perfect.
No.
I still ended up with weird charges and bills and things that I couldn't make sense of.
Yeah.
And yet, there are still differences between physical health and behavioral health. And some of that's appropriate because they are different. But the funding mechanisms, that should not be what keeps us apart and
Yeah.
keeps folks from getting the care they need.
Well, first, thanks for sharing that, because you have that personal story of the care that you got, which sounded like it was pretty darn good,
Mhm.
except for some of the weird billing stuff. But if you look at behavioral health, it's a whole different ballgame. It really is an outlier
Mhm.
in terms of even just access to care. So, for example,
Sure.
if you were really sick, or if you have schizophrenia, for example, let's say someone has schizophrenia,
Mm.
just from a diagnosis standpoint, not even
Mhm.
a care standpoint,
Right.
technically, the person who has these really horrible symptoms of schizophrenia has to wait 6 months,
Mhm.
6 months before even technically getting the diagnosis. And a lot of insurance companies may not be keen on treating someone
Mhm.
if they don't have the diagnosis
Sure.
yet. So that's written into the diagnostic criteria, waiting 6 months. But even outside of that, it takes months and months and months for someone struggling with depression, anxiety,
Mhm.
hearing, auditory, or hallucinations,
Mhm.
which can be really scary, having thoughts of suicide. It can be months and months and months and months of waiting to see someone. How are we going to fix that?
You're not gonna fix it?
I was hoping you were going to.
I think we have to do it together.
But how do
We have to do
we
it
fix it?
together.
How do we do it? What are your thoughts on next steps to fix this? Let's say over the next 5 years.
Wow.
Maybe 10. Just kidding.
Well, what you're really pointing to is just really a backlog in getting services and access to services.
Mhm.
And I hate to make it about money, but it has to be
Yeah.
not just about money, but it also has to be about system transformation.
Yeah.
And so part of why California is at a disadvantage in figuring this out really well is because of our system of care and how it is set up.
Yeah.
We many years ago decided that we were going to move towards parity, with substance use disorder and mental health. And we're getting there. It's not quite there. But I think that we really have to talk about what can we do to move towards parity
Yeah.
between physical health,
Yeah.
and behavioral health in general. And it's going to take advocacy. It's going to take patients telling their story and sharing their experiences. It's going to take laying down some of the silos that we're in and some of the things that we're defending in terms of our turf and our expertise,
Yeah.
and sharing that in a really open way and
Yeah.
an intentional way
Yeah.
to help people get better.
Well, it's interesting. We have parity at the state level. We have parity at the federal level. Lots of parity, but yet not.
Mhm.
Right. So we have the laws, but it's not happening. And I see
Mhm.
this as an internist and as a psychiatrist. I don't have the issues with diabetes management, for example,
Mhm.
or if someone has chronic pain or
Sure.
osteoarthritis of the knee or the hip. I don't see it as much. We can get an x ray if we need it, or we can get the medication if we need it. However, as a psychiatrist, I see that's a problem oftentimes, whether it be access to medications or access to psychotherapists. There's a lot of uh, boundaries towards getting that care.
Yeah.
But I hear you. We have to do this as a team. It has to be sort of a multidisciplinary advocacy effort, not just coming from psychologists or psychiatrists or social workers. But tell me what you think about this.
Yeah.
We should be including the family medicine docs and the internists,
Mhm.
the pediatricians, those who are not technically behavioral health folks,
Sure.
to come together and say, how do we change some of this stuff?
Yeah, that's the solution, an integrated care system, a truly integrated care system.
Yeah.
And a lot of people say multidisciplinary, a lot of people say interdisciplinary.
Yeah.
Those are different things. And so in my training, I trained in a interdisciplinary setting at USC Children's Hospital.
Yeah.
And I share this a lot because that shaped my lens and how I saw the care I was giving and what I needed to do in terms of interventions and connections with other professionals when serving clients. So when I was at USC Children's Hospital, one of the things they did was they made sure that our care team, our
Mhm.
interdisciplinary care team, it consisted of a variety of professionals. So the pediatrician, the school counselor, the teacher,
Yeah.
occupational therapist, speech pathologist, psychologist, psychiatrist, you name it. We sat at one table together, literally, and we did case conceptualization. And
Mhm.
what that taught every trainee from every discipline in that room was that we all needed one another. And what we saw was outstanding results with our clients because they were getting all of their needs met.
Mhm.
The psychologist was able to say, dental, resident, some of the problems they're having is because of their Down syndrome,
Yeah.
and dental problems and etc. All of the things that work together.
Yeah.
You know what? That's actually not a medical problem. There's a behavioral reason for that because I'm seeing them in therapy over here,
Yeah.
or this is what I'm seeing in school coming from the school teacher. All of those clinicians sitting together to do case conceptualization was amazing and it was life changing for the clients.
Yeah.
And so being trained in that type of atmosphere
Yeah.
and then going out to work in other places, I next went to UCLA Children's Hospital. I realized that that model was not how what everyone had access to.
Yeah.
And so I think that if we really do move intentionally towards interdisciplinary care, not just multidisciplinary where folks are present in the room, but interdisciplinary where you understand
Yeah.
the scope, the practice, and the importance of those that are working with you,
Yeah.
then that is what clients need. That is whole person care.
That is whole person care, right? And I agree with you. And I kind of conceptualize it as team-based care
Yeah.
because there's different ways to do it. You can do it educationally where you have all the disciplines and you're
Yes.
talking about some
That's where
stuff
it
and you're learning,
starts.
which is great.
Right.
I think that's where it starts, exactly. But then it has to translate to
Clinical
what happens
settings.
in the clinic.
Definitely. hmm
And if you, for example, let's look at primary care, for example, if you have, the provider, the clinician, and the nurse, for example, maybe a medical assistant, there's your team. It's limited. We know that it's limited
hmm
because the provider's moving every 7.5 to
Oh, yeah.
15 minutes. The nurse is busy triaging three or four things, and the MA is taking vitals for like three different patients. So that's, if we can introduce, for example, a wellness coach or
hmm
peer navigator,
hmm
someone in the mix to spend a little extra time with the patient after the visit
hmm
as a liaison, as a team member for that group. It can happen in mental health too,
Yeah.
outpatient. You have a psychiatrist or psychologist to include someone who
Mhm.
can spend a little extra time with the patient to help with the treatment plan.
When you get the importance of that speech pathologist, that therapist, that oncologist, when you truly understand and you're working together around one central patient, that changes the way you deliver care. That changes the referrals you make
Yeah,
because you're not just seeing it from your training and your scope of practice,
yeah,
you're understanding the need for others to complement, right, on
yeah.
that team.
And that is, I like the term you used, whole person care, because my fear is sometimes if someone's just seen a psychologist, they'll be like, well, I just do counseling for depression. Or if
Exactly.
they see the psychiatrist,
hmm
yeah, I'm just going to give you
It's
medication for
siloed
this.
even within the treatment settings. Yeah,
It's siloed, and that's a disadvantage to the patient, right? I
definitely.
think. But if you're able to have a whole person care, you're understanding what's going on with them at work. You understand what's going on with them at home. You understand what's going on with their diabetes,
Mhm.
their chronic pain, and their anxiety.
For sure.
And you're seeing the same thing then, it sounds like.
Well, definitely. And I think while California has used that term whole person care, and it's true, and that's what we strive towards, one of the things that CBHA has been doing is trying to really bring the community together around whole system care. Because until you change those systems, until you change all of the silos and bring them together, then we can want whole person care, but you know, we're not enacting that. We're not actualizing that because our system is so fragmented.
So if the system's broken, it's hard to have that whole person care.
hmm
I like that way of thinking. You got to fix the system first,
Yeah.
which should be pretty easy to do. I'm just kidding. But no, I love the idea of bringing different disciplines together,
hmm
and the idea of bringing in advocacy. And by the way, when I work with residents or medical students, one of the things that I include in the training is advocating for your patients is
hmm
important,
Definitely.
right? Instead of just here's some biochemistry and here's what you need to know about anatomy. it's important to think about the system
Mhm.
because we work in the system, but sometimes we don't think about the system. We're thinking about our day, our clinic,
Yes, and
our
what we've been
schedule,
trained to do.
and what we've been trained to
Mhm.
do. So, your thoughts on maybe breaking this out to psychologists, social workers, physicians, PAs, NPs, and saying maybe we should have some formalized
Mhm.
training on the importance of advocacy. And
Right.
by the way, how to do it.
Yeah.
Almost like a professional development type
And
thing.
how to do it together,
How
right?
to do it together.
Because we do have advocacy and we do have our guilds and they advocate for individual professions.
Yeah.
But what if all those guilds at the federal level, at the state level came together and
Yeah.
advocated for whole person care together,
Yeah.
right? For whole system care.
No, I love it. I love it. Leandra, if you were to share one thing
Mhm.
to me and the folks on the other side of the camera
Sure.
on one thing on how we can transform mental health care,
Mm.
it's a big question, but what would that one thing be? If you were to pick one thing to strive for, what would that be?
I think it's along the lines of what we've been discussing workforce. It's people that deliver these
Yeah.
interventions and provide the services. And we have to change how people are trained. We have to change how folks work together.
Yeah.
And we have to fund it. So I don't know if that's one
We
thing,
have
but
to
it's
fund it.
really around training and funding
Yeah.
and continuing education,
Yeah.
even when folks are in the workforce, around how team-based care
Yeah.
works together.
Yeah. If anyone listening has questions or wants to get in contact with California Behavioral Health Association,
Yeah.
what's the best way to do that?
Well, you can Google us
Okay.
and look us up on the web, it's calbha.org,
Okay.
and anyone will be ready to reach out and talk to you. We've got a
Awesome.
lot of work to do, and we're ready to do it
We
with you.
kind of do, don't we? Thanks for talking with me. I really
Thank
appreciate
you.
it, Hunter. Thank you so
Appreciate
much.
it too.